Hi, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. That is also one of the most commonly asked questions I get. Yet yes, contact lenses can be very convenient. They are very easy to use, very easy to dispose, and the chance of complications is very rare. But yes, they have their set of complications. But contact lenses have their own problems when you are there for an active lifestyle. Let's say you're going swimming. Wearing a contact lens while going swimming is a big no-no. Why? Because the water that you're going into has multiple germs. It has so many types of infections, so many types of bacteria, viruses and fungi that are in the water. And if you wear a contact lens during this time, the chance of an infection goes very high. So definitely never ever wear contact lenses while you are going for swimming. And yes, also for other sports activities also, contact lenses are convenient, but they can have their own side effects. I'll give a very short example. A patient came to me, she loved to do boating. So she had gone boating and she was wearing contact lenses. So when she was in the middle of the river and she was boating, there was this big or very fast breeze and her contact lens flew away. That happens, yes. A contact lens is just snugly fit onto your cornea. If there is a very fast gush of air, yes, or a fast wind, the contact lens can get blown off and you can get stuck in the middle. So these are some set of complications that you face when you are wearing contact lenses in your daily activities. Getting a LASIK or a refractive surgery done takes away all these complications and you are sorted for the entire journey till the age of 40-45. You will not have to wear contact lenses. Any chance of complications because of lenses is not there and you are very comfortable. No and yes. So why no? Because contact lenses give you, so we have different types of contact lenses. If I look into it that way, you do have a simple contact lens that takes care of power for distance, and you also have multifocal contact lenses. So if you are getting your refractive surgery done, you will technically not require glasses till the age of 42 to 45. Because at that age, that is when we require glasses for reading. Something known as presbyopia sets in. So when we are young, the muscles inside the eye are strong. We can look at something at a distance and then start reading immediately because the muscles are functional. But after the age of 40, these muscles start getting weaker. I will not be able to read something at this distance immediately after looking at something at a distance. So my distance keeps increasing till about this distance when my arm cannot go any longer. To get my distance back again, I have to wear glasses. So that is something that is a natural phenomena that happens to everybody and nobody will be spared. Everybody will require reading glasses at around the age of 40. So if you are getting your LASIK done at the age of 20, you get about 22 years of spectacle freedom. And after that, you will require to wear glasses. So answering your question, that contact lenses will take care of your glasses for about 20 years. After that, after the age of 40, you will require glasses again. Alternatively, you can always wear multifocal contact lenses. And yes, the second part of your question, you can always wear colored contact lenses after refractive surgery. Once a refractive surgery has been done on your cornea, wearing a contact lens is no problem at all, except for the first 15 days when the healing process is going on. After that, you can always wear colored contact lenses. No worries. That's a very complicated question. That once you are into adventure sports and if you wear contact lenses, like I said, the contact lenses just snugly fit inside your cornea, on top of your cornea. So if you are going scuba diving, of course you will be wearing glasses once you're going scuba diving, and also if you're going skydiving, you'll be wearing glasses. But let's say if you are going skydiving, the glasses that you wear are not snugly fit. If there is any wind or air that comes inside your glasses, the contact lens can actually fly off. And yes, it can be a problem, definitely mid-air. Big no-no. So again, contact lenses are a small lens-like material that is placed on top of your cornea that we are not putting any glue. It is just stuck onto the cornea, snugly fits. If there is any force that causes the contact lenses to move, they can come out. So after a long day, you can have dryness in your eyes. Your cornea is, of course, it is tired. And once there is any slight movement or if you blink very, very tight, the contact lenses can get displaced and they can fall out. So once they do fall out, never ever put them back. Why? Because now the cornea, the contact lens has fallen down and it could have been infected. So if you put this contact lens back into your eye and your eye in that dehydrated and weak state becomes very prone to infections. So putting this contact lens back can have very disastrous complications, including a very severe infection. If your contact lens does come out, please discard it and wear a new pair of contact lenses.
Follow Planet LASIK and post your queries to get answers from the experts.